Good morning. My name is John Muffoletto of General Surgery of Anchorage, Alaska. I hope everyone's doing well. I did my first video on April 3rd and got a pretty good response to that, so I'm going to keep doing these as long as my patients and people feel that they're helpful. And I do think that they're helpful in a way that you get a lecture and you just get a bunch of slides to study, and I know we're all going through that now with our children, and sometimes you miss the true meaning of what's going on if you don't have someone to explain it to you. So a couple of things that I wanted to talk to you about today are going to be brief. We're going to update you on how we're doing as an office since we started our telemedicine platform, and then move towards what we're doing with elective surgeries. I think those are the two most important things to touch on. So last time I spoke, we were moving into complete telemedicine, and that's been going pretty well. I want to hear some of your comments and feedbacks on how you like it, and I think the patients seem to like it, got a good response. At this point, the office is doing very well with it, and we have all our forms loaded on the advanced MD platform, and we're making it extremely as easy as possible for our patients at this point. Lindy Davis, my office manager, is helping to orchestrate all of that. Again, 276-1046 is my number, so any questions that need to be answered, Lindy Davis will be happy to do that for you. Presently, you can download all your information right on the Secure Site webpage. The Advanced MD, there's some specific things that you need to get to that, and Lindy Davis could help you do that. Office seems to be doing well, and we're excited at this point to start to open things up for people. The governor's mandate just came out on April 15th. Mandate 015 was a bit confusing for not only the people out there, my patients, but caregivers as well. And this is the reason why I think I have this platform to talk to you about that, because I was able to really talk to some of the hospital administrators, and Ann Zink, Dr. Zink herself was at the staff meeting at Alaska Regional Hospital last evening and cleared up a bunch of things for us. So with that, I think we're getting close, which is a good thing. I think opening up the economy slowly with certain steps in our economy is real important. And Mike Dunleavy seemed to think that the medical industry was an important first step, which I agree. So at this point, the mandate 015 section 4 really was the important thing, and it's a framework. It's not that on such and such day everybody's now going to start to have their elective surgeries. First of all, it's opened up slowly at this point for a lot of chiropractors and physical therapists and dentists. A lot of those medical industries that are more of low risk, and the higher risks type of surgeries that I do as a general surgeon. At this point, we're looking at tentatively May 4th, and that's quite a bit better than the June 15th date that was proposed. But there's some catches and caveats to that, and I think this is good, it's healthy, it's safe, and that's what we want. It's good that we're moving quicker. We have the PPEs at this point in each of the hospitals, and they're not overwhelmed, and this really was part of the reason why we weren't doing any elective surgeries, to make sure that we had all the equipment for the people who needed them. And we've accomplished that, and we've done a good job as a society here in Anchorage, where we're flattening out our curve a lot faster. And I think that people are doing super. So at this point, on May 4th, we're looking at doing some elective surgeries for the people who actually get a little bit higher up on the list, meaning that they can't wait another 6 to 8 weeks, which is really what is the time frame that was originally proposed. Those people that can have their surgeries on May 4th need to be of low risk type of surgeries, and they need to be tested for negative for COVID-19. So that's an important point. We need to have the testing capability. So yes, we're saving our PPE and we're saving all the equipment that needs to be done at the hospital, and that they're not overwhelmed. That's been accomplished. Now, what's the most safest way to proceed with our patients? And I think both hospitals and surgery centers agree on this, that those surgeries that now we can open up on May 4th, what's the safest way to do that? Is to have a testing center in place where all our patients could go to get safely tested. And then if they test negative for COVID-19, they can have their surgeries within a 48-hour to 72-hour period from the test. That's a safe protocol. That means everybody in the operating room is protected, the patient is protected, and we're now coming up with evidence at this point that these asymptomatic carriers are very high up in our out in the society. It could be 50%, 70%, depending on what studies, 90%. Some studies show that a lot of people out there that are simply asymptomatic carriers, but they can transmit the disease and the virus, number one. And we are seeing medically that those people who are asymptomatic, that have virus positive, if they get on to be intubated in the hospital, they don't seem to be doing very well. So just doing these procedures electively on these patients that don't have any symptoms but are virus positive is not safe for them. So if the caveats can be met, meaning that the surgery starting on May 4th for those patients who really need them, that are in increasing pain, they've been really good stewards at this point, trying to wait it out for their surgery, but it's becoming more and more harder for them to do. They're falling into that category, excuse me, that can't wait additional time. And we have the testing capability in place, which is an important point, and they test negative, they can then move on to their elective surgery. And I think that's a very, very safe plan for everybody. And the hospitals will be opening up both at Alaska Regional Hospital, Providence, and Surgery Center of Anchorage, which is the center that I'm involved in. So, sum up, I think overall, the office is doing well. We've learned a lot. I think everybody's learned a lot with telemedicine, and I think it's here to stay. And we plan to have that in the future for our patients that are out in remote areas. It's hard for them to come to see me, that I can start doing some more telemedicine that way, make it easier so that we can do just a one trip type of protocol for the patients then to just come, get their surgery, wait an appropriate period of time before it's safe for them to go back home. And I think that would be safe and economic and easiest for the patient, which is what this is all about. Okay, I hope to start operating again. I know I've got a lot of phone calls and people want to be helped, and that's what I do. So I'm hoping to start moving in May safely, as long as we have the testing to start doing that again. Again, as long as people want me to continue doing these video formats, I'll be happy to do that. All right, thanks everyone. Thanks for everyone's patience and support, and stay safe. All right, good day. Bye-bye.